Good evening and welcome to another session here at Montgomery Heart and Wellness. And we're going to be talking about diabetes. It's a debilitating and deadly disease. And you should all understand how this disease can affect your life. Now, first and foremost, I want to give an overview because diabetes has multiple manifestations. First, I want to emphasize the fact that diabetes is not a blood sugar disease, but it's really a blood vessel disease. It's deadly and debilitating. Our hearts goes out to many individuals suffering from this horrible condition because we see these patients on a daily basis. The facts are simply this. In the United States, 9.7 million individuals have undiagnosed diabetes. 29.3% of these individuals have diagnosed diabetes. And about 115.9, almost 116 million people have a condition known as prediabetes. When you have prediabetes or diabetes, you already have the early effects of vascular disease. These numbers, when combined, represent essentially almost half of the US population. So this disease not only is very devastating, but it's also very prevalent. Now, I'm going to have here my friend in the background, Dexter the mannequin, and I'm going to have his foot, and we're going to help you understand the nature of this disease and how it can be debilitating. First and foremost, this disease affects circulation. Poor circulation of the lower extremities can lead to amputation of the foot and eventually amputation of the lower extremity. So other conditions related to poor circulation are pain in the legs and feet. So oftentimes diabetic will have tingling sensations. They may get ulcers that are difficult to heal. And this will eventually lead to infections that don't heal and potentially amputation. So once you start getting early symptoms of tingling, pain, soreness in the feet, you need to pay attention to these symptoms because amputation is the end course, and that leads to decreased mobility. Now, the next problem is kidney failure. Kidney failure is probably one of the major causes of diabetes. And if you look at my friend here, Dexter, you see the kidneys are on the back of the body. So we've already taken off Dexter's foot. The next thing potentially would be one of his kidneys or both of his kidneys. And so kidney failure can lead to a very significant, what we call morbidity or level of illness in diabetes. First of all, you have protein loss and swelling. You can have what's called electrolyte abnormality, so you don't manage your potassium, magnesium. This leads to irregular heartbeat, and kidney failure leads to the end result of dialysis. The next is stroke. Stroke, many diabetics can have stroke. You can have subclinical stroke that can lead to a condition known as dementia. It can also have progressive dementia to where it minimizes your independence and mobility. So if you look at our friend Dexter, the mannequin here you have the brain. So we've already dismembered the kidneys. We've already taken off an extremity. Now we're affecting the brain. And so what are the effects of stroke? Essentially, you have cognitive decline. You can't remember where you leave your keys. You can't remember what you do with important items in your life. It gets so bad where you get to advanced dementia. You don't remember your children, your neighbors. You can also have paralysis due to a major stroke. And advanced dementia can lead to nursing home living quarters or advanced debilitated state to where no one is able to live independently and you have to have 24/7 care. The last major effect is heart disease. And heart disease is a major problem with diabetics. Our mannequin here, we've dismembered the heart. So you can see with a mannequin, diabetes essentially dismembers the body from the inside out. Heart disease starts off with symptoms such as chest discomfort. You can have shortness of breath. You can have heart failure, which leads to advanced disability. It may lead to the requirement for bypass surgery or even a heart transplant in many diabetics. In fact, there are many diabetics who have both heart failure and liver failure who may need a double heart and kidney transplant. And of course, you may be at risk for cardiac arrest. That's even if you have diabetes with renal failure and heart disease, or just diabetes with heart disease. So again, this debilitating underlying disease known as diabetes, and we mostly focus on the blood sugar aspect, but this is really a vascular disease. And so this disease, even before you get the diagnosis of diabetes, when you're pre-diabetic, and even many individuals before they're pre-diabetic, they're insulin resistant. And as insulin resistant diabetics, they get advanced vascular disease. So by the time you're diagnosed with diabetes, you may have advanced heart, kidney, peripheral circulation, or brain disease that may be caused from diabetes. Now, before I end this talk, I want to let you know heart disease underscores virtually every underlying illness you have. Many individuals with cancer or arthritis that have underlying heart disease that eventually may take them out. Heart disease can sneak up on you. We have developed a Heart Strong quiz. You can go to the section in the comment section and take a Heart Strong quiz. There are about 8 to 10 questions you answer, and based on how you answer, we give you a score. And so it gives you some insight in terms of how strong your heart is. So I hope this information was helpful to you. And if you have any question, as usual, leave it in a comment section, and my team and I will look forward to getting with you. If you're new to this channel, as usual, please hit the subscribe button. And anyone who is here, share this and give us a thumbs up to help with the YouTube algorithm. Until next time, take care.